Hello and welcome. Today we're talking about the anti-inflammatory diet and how this simple shift in how you eat can make massive changes in your health in as little as 2 weeks. But in order to get this to work for you, there's some extra information that I need to give you in this short video. But first and foremost, let me tell you how we discovered the anti-inflammatory diet. My name is Dr. Jay Hitson, and I've been a holistic physician for over 25 years. At one point in my career, I was running a multi-million-dollar regenerative medicine practice. For those of you who don't know what that is, just think stem cells. So in our practice, all of these individuals will be coming to us for various joint and pain issues, knees, shoulders, hips, the like. And we were using stem cells to address all of these various pain issues that our patients were bringing to us. What was really fascinating was how you would have one individual who would get amazing results with the stem cells, but then you would have another individual who had pretty much the same exact condition and get no results at all. It drove me and my team crazy. We had to know why this was happening. So in our pursuit to find the answers, one day Greg came in. Greg was suffering from bone-on-bone knee pain. He was trying to prevent, at least prolong, the inevitable knee replacement. Now, anytime we have somebody who's dealing with knees, if they're overweight, we usually put them on a special diet because here's the major factor with knees. If you just keep having that pressure, because for every pound of weight, it's 3 additional pounds on the knees. So just losing even 10 pounds can take 30 pounds off of those knees. So anytime we have somebody who, needs to drop a few pounds, we put them on a particular whole foods based diet to start to reduce the weight. Now, in Greg's particular case, he came in, we gave him the diet, but then before he left, he said that he couldn't be back in for his stem cell injections for about another 2 weeks. But would it be okay to go ahead and start the diet anyway? We said, absolutely. The less weight on the knees, the better they're going to feel. Now, here's where everything changed. Greg came back in 2 weeks later, having totally followed the diet, and his knee pain was all but gone. And he asked us, do I even need the stem cells now? We were fascinated by the incredible results that Greg had gotten, and we wanted to see if more and more people could get the same kind of outcomes. So we started putting more and more people on this particular whole food based diet. And what we discovered is that it wasn't because of the weight loss per se, because some people were coming back exactly the same weight that they had been, 2 weeks prior, but their pain and inflammation was dramatically reduced. The diet was reducing their inflammation, and as a side effect, they were losing some weight. Well, then we started putting every one of our stem cell patients on this particular diet, and we started finally getting the consistent outcomes that we were looking for. Over the course of these months and these years, we continued to refine out the exact things that needed to be included and not included on this anti-inflammatory diet. Now, here was one of the biggest struggles that we came across. We had so many individuals who inflammation wasn't their only problem. Again, they were also dealing with weight issues. Some of them were dealing with glucose or diabetic factors. Other people had thyroid issues, and some people had hormone imbalance. What foods are safe for all of these different groups? So after a long process of trial and error, what you are going to see today on your anti-inflammatory diet is what worked. And it's what worked for people who had a diverse amount of health concerns. So there are 3 big things that you need to know about inflammation. Point number 1. We consume most of our inflammation. So when we run our blood panels, we have everybody fasting for 12 hours. When we run these numbers and we look at individuals who swear they have inflammation, but when they have no food in their system, their inflammation markers are at 0. That means the majority of their inflammation is coming from the foods that they eat. And then when we shift their diets around, all their symptoms go away. Number 2. Inflammation is a big business. Supplement companies have all of these different products that are promising you relief from your inflammation. And while that's all in good heart, it may not be addressing the root cause of your particular inflammation, which means it's just going to come right back and you're going to need more and more of their products. Furthermore, the pharmaceutical industry has made billions using products like steroids and anti-inflammatories like ibuprofen. And point number 3 is you need to understand the side effects that you're going to be dealing with if you are going down some of these pharmaceutical routes to address your inflammation. Ibuprofen is known for tearing up your kidneys, your liver, your GI tract. And steroids, especially steroid injections, they're known for demineralizing your bones. When you look at it from this perspective, The food industry, the pharmaceutical industry, the supplement companies, the weight loss industry, no one wants you on this diet. So implementing this diet, there's a few things you need to know. First and foremost, when you eat this way, your body is going to shift from burning carbohydrates to burning proteins. It's a lot more work for your body to burn protein than carbohydrates. Carbohydrates are easy to break down. So what your body will do for the first 2 to 3 days when you are making this shift, you will feel like you are starving. This reaction has a lot more to do with your body just not wanting to work so hard to break down your food. It really has nothing to do with the fact that you're not getting enough calories, nutrients, overall nutrition. In fact, you're probably getting more. Just be aware of how this reaction happens, and it's only going to be for about 2 to 3 days. Just hang in there, you'll get through it. One of the ways to help yourself out during this time, though, is to drink a lot of water. It will trick your stomach into feeling it's full. It will flush out all the different toxins and just different inflammations that have started to gather up in all of your tissues. And along this lines, if you're somebody who has been consuming a large amount of sugar, there is such a thing as sugar detox. If you've never experienced sugar detox before, it can actually have like flu-like symptoms. Just know that you're probably not actually sick. You're just getting rid of all of this stuff that needs to come out of your system anyway. Now, when you go through the diet, it's going to be a lot of meat, vegetables, and fruits. Please don't message me about how there's more inflammatory properties to meat and less in grains, and so why didn't we include grains, and why is meat on the list? When you're trying to create a diet that balances so many different factors, not just inflammation, this is the diet plan that ended up working for the vast majority of the people in our program. Now, also keep in mind that this particular diet plan, it is not customized to you, and it may not even be right for you. This is why we always do individual personalized biodata. We get your blood work to find out, is inflammation even your problem? And let me tell you, most of the time, it actually isn't. So if you do want to eliminate all the trial and error, order your exploratory panel and we will find the solutions that are right for you. And for those who need advanced level support, we have programs for you as well. I encourage you to follow us on our socials so you can keep getting free access to all the products and programs that we are finding that are working so consistently for so many individuals. But if you're ready to eliminate all the guesswork, if you want to stop wasting time and money on things that just don't work and get real solutions based on your biodata, and not a Google search, then go to our website and order your exploratory panel today.